Okay, I'm going to get started, Mary.
Jackie's getting started.
The broadcast is now starting. All attendees are in listen-only mode.
On behalf of Bancroft Brain Injury Rehabilitation, I'd like to welcome you to this afternoon's Heads Up webinar. I'm Lynn Tomeo, and I'll be moderating today's event, The Benefits of Mindfulness-Based Interventions. Bancroft is pleased to offer educational opportunities such as our Heads Up webinar series designed to give brain injury professionals the opportunity to gain new insights from our clinical experts while at the same time earning educational credits. Today's webinar is worth 1 CEU and credentialed by CCMC for nurse case managers, CRCC for certified rehab counselors, and NASW for social workers. General attendance certificates will also be given for 1 clocked hour. Our presenter today is Dr. Mary Brownsberger. Dr. Brownsberger works primarily in Bancroft Brain Injury Services Rehabilitation Program in Plainsboro, and she is just one of a small number of professionals nationally to receive certification from the American Board of Professional Psychology in the area of rehabilitation psychology, which is a specialty within the field of psychology that focuses on assisting people with an injury or an illness in achieving optimal physical, psychological, and interpersonal functioning. Dr. Brownsberger also recently received the 2011 Early Career Practice Award from the APA's Division of Rehabilitation Psychology, Division 22, and was installed as President-elect of Division 22 in August of 2012. If you have any questions during the presentation today, please enter them into the chat area that's located on the side of your screen. We'll address questions at the end of the presentation. Before tomorrow, you'll receive a brief survey via email, which will enable you to receive a certificate for participating in today's session. So thank you again for joining us, and now I'll turn the event over to Dr. Brownsberger.
Thank you, Lynn. Welcome, everyone. This is kind of an odd topic to do on a webinar, but I have a lot of good information to share. I also have designed this presentation so that hopefully you listening in can actually experience some mindfulness practice. I want to start in what may seem like an odd place when the focus of the presentation is about mindfulness, but I want you to keep in mind that this is applying mindfulness-based interventions to brain injury rehabilitation. And so we really need to start with a grounding in brain injury specifically and in understanding disability in general. And the place to start with that is really the ICF, or the International Classification of Functioning Framework, that was developed by the World Health Organization. Within this framework, abilities and limitations are described as influenced by a lot of different factors. There's the underlying disorder or disease itself, the health condition, and its impact on body functions and structures, activities, and participation. In addition, there is an impact by various contextual factors, both in the environment and in the person. So it's a big, complicated picture. It's hard to describe. The main point is to consider that brain injury impacts everything, all of these. It is a structural disorder. It impacts other body functions and structures, which can in turn impact activity and limit activity, and it can thus impact and restrict participation. So the next question is, well, what is mindfulness? It's more and more in the popular lexicon, but what is it really? So we want to start with a definition that came from John Kabat-Zinn, who really started applying mindfulness to medical settings 30 years ago. And his definition is the non-judgmental cultivation of attention and awareness. In other words, what we're paying attention to is the actual experience in a given moment versus interpreting it, elaborating on it, having opinions about it. What is the actual experience? And let's pay attention to that. So then, what is the relationship of mindfulness to the International Classification of Functioning? The reality is that some things are difficult to change. Health condition, body functions and structures, even some contextual things. We're not always able to change the environment in which we're embedded or some of our personality traits. What we can change is how we respond to those situations and to conditions and factors. And that's where mindfulness can come in handy. Viktor Frankl, many years ago, wrote, "Between stimulus and response, there is a space. In that space is our power to choose our response. In our response lies our growth and our freedom." Think about how small that space is between stimulus and response. And I would argue that even the most experienced meditators, those, the stereotypical Tibetan monk in a cave meditating for hours and hours a day, if a bat flies over, there's probably some sort of a stress reaction, that automatic reaction to something, to that stimulus. And what happens when we react to change, sudden change, any change, is that our heart rate goes up, our blood pressure goes up, our respiration rate goes up, our immune functioning goes down, our digestion system is affected, our muscles get tight, basically everything that's affected by the sympathetic nervous system, or some people might say by our adrenaline system. There is a choice. Even if what we're doing is catching our breath and tightening and kicking in that sympathetic fight or flight system initially, reacting, we can then choose to respond in a different way and activate the parasympathetic system, that system that allows our heart rate and our blood pressure and our respiratory rate to return to baseline. And for our immune functioning and for GI functioning, gastrointestinal functioning, to start working normally again. So why talk about mindfulness after injury? Think about the impact of stress on all of us, how we think about things, process information, solve problems. What's the impact on our immune system? What's the impact on healing? And specifically after someone acquires a brain injury, the challenges that go along with that, just basic self-awareness can be impaired. The ability to regulate emotions, impulsivity is connected with that, attention, and often chronic pain. So lots of additional stressors on top of those that those of us who have not experienced a brain injury also experience. So what mindfulness-based stress reduction, which was designed by John Kabat-Zinn, and there are many other forms of mindfulness practice, they're all very, very closely related, and his summation of that is very useful when we're dealing with medical populations. It helps us to regulate our response. and to practice activating that response instead of only responding or reacting to stress in that involuntary, automatic way. The American Psychological Association just a few months ago published this wonderful summary article about the benefits of mindfulness. This is not restricted to brain injury in any way. For all of us, there are a lot of benefits that include reduced rumination or thinking about things over and over, improved working memory and attention, concentration, improved ability to be flexible, to not get stuck in one way of thinking and not be able to consider other viewpoints. How quickly we process information, our immune functioning again, emotion regulation, and it's amazing. The psychological benefits, in addition to our own emotion regulation, are that there is increased relationship satisfaction, increased empathy, compassion toward others, enhanced self-awareness. So lots of really good, amazing benefits of a mindfulness practice for all of us. There's also actual changes in the brain structure itself. People who meditate have changes in their brain that are measurable. One very interesting study that was completed in 2010 looked at using functional MRI, the relationship between the size of the amygdala, which is a midbrain structure that's related to emotion processing, and particularly to stress and to anger and frustration processing. And as the level of perceived stress increased, the size of the amygdala increased. And as the level of perceived stress decreased, the size of the amygdala likewise decreased. Another really interesting study done by Grant and colleagues also in 2010 looked at areas of the brain that were related, have been known and found to be related to pain sensitivity prior, actually got thicker when the mindfulness practice resulted in reduced sensitivity to pain. So you know that old expression, yeah, you just need to grow a thicker skin. Well, actually, our brain does get thicker when we're using mindfulness to reduce our sensitivity to the pain that we may be experiencing. There's also an increase in basically the area of the brain, in the number of creases and folds in areas of the brain that are related to attention and to emotion regulation. So it does actually result in increased area of brain, of our cortex involved in those processes. There are also changes in the connectivity, in the neuron activity, as well as in the actual physical structure or gray matter. There are changes in the white matter neurons. That's measured in a lot of different ways, often using EEG. And there are changes in the gamma bands that EEG uses to measure activity in areas of the brain that are related to mind wandering, self-reference, paying attention. Similarly, markers of attentional control. There seems to be a lot of evidence building that mindfulness does impact the brain structures and connectivity that's related to that attention mechanism, as well as self-regulation and being aware of oneself. This is Dr. Michael Boehm's brain. He runs the mindfulness program at Penn, and I was fortunate enough to find this article that he wrote just a few months ago also. And he talked about how the brain changes when one is meditating, and actually had this scan available that shows his brain at baseline and during meditation. And I want you to pay particular attention to where the red is on the baseline and the meditating. I know the print on this slide is small, and I do apologize for that. But pay attention to the red areas and notice those changes that actually show an increased metabolic activity. So one thinks about meditating as quieting the brain, calming the brain, and it does because of the areas of self-awareness and attention that are more active. So how do we apply this to brain injury rehabilitation? The research is still in its infancy when applying mindfulness to brain injury rehab. But there are some good studies that are starting to come out. One is using specific dialectical behavior therapy skills, which are mindfulness-based, to help folks who survived brain injury regulate emotions. And the particular study was designed to address emotion dysregulation when the barrier was community participation. What they found was that there was difficulty in generalizing the skills from one setting to another, as there often is when you're working in brain injury rehabilitation. So the task is to figure out how to help generalization. There's also a study just to figure out whether a mindfulness-based stress reduction curriculum could work in an acquired brain injury population. What this group discovered was not only was it possible, but that it helped both the clients and the staff involved in the study. So the next steps are to evaluate the outcomes. Similar to the studies on the brain's structure and function, there are studies that look at the use of mindfulness in a more applied clinical setting, using mindfulness techniques to improve attention. So this study uses a mindfulness strategy that's embedded in goal-oriented attention training to stop, relax, refocus. And the results were that the participants did improve. There's also research recently on the effects of mindfulness-based stress reduction to reduce symptoms among folks who are experiencing chronic mild traumatic brain injury or post-concussive syndrome symptoms. And Dr. Azoulay and her colleagues at JFK found an improved quality of life, improved self-efficacy, working memory, attention regulation, and improvements that these improvements were likely related to improved awareness and self-acceptance. There's some really basic but very important concepts when we're talking about what to consider in a mindfulness practice. The first is that there's more right with all of us than there is wrong. And I can't emphasize enough that goes for everybody, whether that's someone who's survived an injury and has a very obvious disability, or just, any of us going through our days. Another really important concept is to simply notice what is. Our brains are wired to analyze and to have opinions and judgments and to evaluate. And those are all good things. And if we take it too far, it can result in dysfunction rather than in improved functioning. There's great benefit in considering that we're all works in progress, and that work is ongoing throughout our lives. So be kind to yourself. Integrate practice with life. The ideal will never happen. So show up. So I'm glad you showed up today. Here's what John Kabat-Zinn has to say about showing up. Guess what? When it comes right down to it, wherever you go, there you are. Whatever you wind up doing, that's what you wound up doing. Whatever you're thinking right now, that's what's on your mind. Whatever has happened to you, it has already happened. The important question is, how are you going to handle it? In other words, now what? So what's amazing to me is that by changing our thinking, by changing what we pay attention to and how we pay attention to it, we actually change our brain. And what I would like to invite us to do is to actually do a practice right now. I wish I could see you so that I could see how you're all sitting, whether you're paying attention. So I'm going to assume that you are. I want you to be comfortable, but with good posture. Sit with dignity. You can close your eyes if you're comfortable. Bring your attention to your abdomen and focus on your breath without trying to change it. What does it feel like to breathe in? Where in the body do you feel that breath? In the nostrils, in the back of your throat, as your lungs fill, what parts of the body expand? As you're exhaling, where do you feel it in the body? What are you thinking about right now? What are you feeling right now? Simply notice. There's no need to judge it or try to change it. I'm going to actually be quiet for a little bit. I'll ring a gong, and then I'll ring the gong again after a few moments of silence to allow you to experience mindfulness. So if your eyes were closed, slowly open them. Notice now the breath, body sensations, sensations of discomfort or relaxation. Notice thoughts flowing through the mind. Some of you might be experiencing a thought of, oh my goodness, that took forever. That was really uncomfortable to be quiet. Some of you might notice, oh my goodness, I fell asleep. Some of you might notice other things. So the invitation now is to sort of sit for a minute. Consider that for yourself. Notice what was present for you. There are a lot of resources for mindfulness. I've listed a few. Full Catastrophe Living is a book that I rely on quite a bit. It describes the mindfulness-based stress reduction particular framework. Dr. Kabat-Zinn has also provided a lot of other really good material that's useful regardless of whether one is a beginner just doing this on your own or whether you're part of a larger group or even leading or participating in a mindfulness group. There's also the Center for Mindfulness in Massachusetts. That link is on this slide. Local to Philadelphia area, there are a couple of programs that are university-based, one at Penn, one at Jefferson, and those links are given. We'll make sure that we're able to post this presentation, all the slides on our website after this presentation is completed. There are lots of other folks out there. Tara Brock has done some good work. Pima Shodran. Lots of folks have a lot of materials that they've shared that give you the basics on mindfulness. When applying it to brain injury, what I find is that it's very useful. Folks are receptive to using mindfulness. What we may have to do is adapt the language we use to describe it so that it's for someone who's got a cognitive challenge, it makes it more accessible. We might also need to slow down, which I've noticed just in practicing 3 minutes of mindfulness, I've slowed down and feel calmer. So I hope that some of the rest of you have also experienced that. From someone who's participating, another resource is Practicing Mindfulness, an Introduction to Meditation. Tom, could you share us who the author is for that? It sounds great. So the next couple of slides are just the references that I used. I'm not going to read these, I promise. And I would be happy to entertain discussion, continue questions, see if we can dialogue a little bit about what the experience was for you, any questions you have. Okay. So we're coordinating here.
We are. We have a couple of questions that came in. Thank you, Dr. Brownsberger. I was trying not to participate fully because I thought if I got too relaxed, I wouldn't be able to come back on and join you. So, but thank you. It was really, really interesting, and it's nice to have be able to participate along with the presenter. So one of the questions is there any research that indicates how long it takes for the brain to actually begin to change when mindfulness is utilized?
How long it takes? Actually, it's amazing. In some of these studies, the change was observable as the study participants were in the fMRI, the functional MRI. So it's amazing how observable change happens very, very quickly. I wanted to double back and follow up on Tom's suggestion, the resource. Let me just scroll until I find the answer here.
I see that. It's Dr. Mark Musée. I'm going to say that pronunciation. I may be wrong. It's M as in Mary, U-E, S like Sam, S like Sam, E, of Rhodes College. And Tom from BIA and Jay said it's a DVD, CD program offered by the Great Courses.
Thank you, Lynn.
And we have another question that asks, it says, Dr. Brownsberger, you mentioned that mindfulness is useful in working with people with acquired brain injury. What are the observable outcomes of this, and is it useful?
Good question. It's useful in a lot of ways, and I think that the literature, the studies that folks are doing now are supporting what many of us are seeing clinically. What we're doing now at Bancroft in most of our brain injury rehab programs is actually starting every day with a little bit of mindfulness. I'm talking 10 minutes maybe here, not anything that's long. But when individuals come in, they may have had a stressful beginning to their day, just getting transported, going through that transition from home to program. It offers them a little bit of space to get grounded. And what we notice is then people are less likely to engage in inappropriate behavior, I guess would cover it all. Verbal aggressions, physical aggressions, even behavior that doesn't rise to that aggressive level, but maybe just not able to pay attention. We find that if we help them to practice some mindfulness first thing, it changes the whole rest of the day. They're better able to participate and to engage in therapeutic activities.
Great. Okay, there's another question, and it asks, how do you work with clients who are very rigid and closed-minded in their thinking due to their brain injury?
This is a great opportunity to use mindfulness, perhaps embedded with some motivational interviewing strategies, if you're familiar with that, which basically is rolling with the resistance. Fighting someone or arguing directly doesn't really produce any positive outcome. But if what we're able to do is listen to validate what feelings they may be having, engage them at a level where they are, and to be present with that, that can start actually to shift to help them to open up and be less rigid.
Okay.
I hope that answers your question. Feel free to chat back if I haven't quite covered it.
And I think we have some time for a few more. How difficult is it to engage individuals who suffer from a brain injury in mindfulness-based treatments? So, for example, what abilities or level of function must they possess in order to participate in mindfulness-based treatments?
Gosh, I think at some level everyone's able to participate. There may be more resistance from some folks, less willingness to participate. Often if we encourage them to say, that's fine, how about just one long, slow, deep breath? And sometimes that's okay. That people are willing to do that, and then realizing and maybe a little benefit from that, and then you take it to the next step. I'm sorry, I think I lost track of part of the question. I do apologize.
There was one question here that said you partly answered my next question or a follow-up question, and that was for any recommendations that you might have, Dr. Brownsberger, for practicing mindfulness exercises a certain number of times per day, and I guess we would follow that up too with maybe at certain times during the day.
That's a good question. Dr. Kabat-Zinn, and I did participate in some training that was conducted by him and some of his colleagues, would recommend that a meditation time be 45 minutes, that it takes that long to settle in and to really benefit. What's interesting is, while I believe that, and I find that to be true for myself, a lot of the more recent literature is supporting that it doesn't take that much time, that one can see a benefit from much briefer periods of practice. So a 5-minute or 10-minute, sometimes even less. Also, simply being mindful while you're going through your daily activities, simply changing your mindset so that what you're doing is approaching that activity. Often I'm on the road a lot, so for me, a mindfulness practice time is when I'm driving. And so instead of listening to the radio and letting my mind go to think about my day or yesterday or last night or whatever else might be going through, it's bringing the mind back to paying attention to driving and to simply focusing on the road ahead of me, what's around me, like all of us, as if we want to be good drivers, should be doing anyway. And so for me, it's both. It's improving my driving skill, and it's giving me an opportunity to practice mindfulness in a very applied way.
Okay, terrific. And there's another question that asks if you keep data on reductions in maladaptive behaviors, so changes in disruptions to daily routine, different engagements with housemates. And I suspect that means if mindfulness-based treatments have an effect on these behaviors, and do we track that?
We're starting to do that more formally. I think in a lot of programs that it is done, and we do go back and look at incident reports and what's being reported in different settings. Our goal is to get some more data and to actually design some research that we can do some pre and post tests. Clinical observations certainly indicate that it's worthwhile to do that.
Great. We have a couple more questions, Dr. Brownsberger, if you're okay with that.
Yeah.
Great. And here's a big fan of the brain scan slide. And they say that the brain scan slide was amazing. And their question is this part of the reason why we're told to rest, in capital letters, really rest? No reading, no TV, no gaming after concussion. Does resting have an effect that's similar to mindfulness-based treatment?
Oh gosh, that's a good question. I think that how we rest matters, certainly. And when we're healing after a concussion, I'm not familiar with the literature about mindfulness and that rest period. I don't know that there's a lot of study in that particular area. From my own experience and the literature that I am familiar with, I would say yes, engaging in a mindfulness practice would be useful because it would help one to be aware of when their mind is no longer at rest. If what we're doing is worrying about, oh my goodness, I'm missing work, or I'm missing school, or I should be doing this, or why do I have to do this, or all of those different thoughts. If what we can do then is to accept, okay, this is not fun, it's not what I want to be doing, and it is what I am doing. And so let me just focus on my breath.
Okay. And another question asks, do you recommend music as part of any exercises? And do you know of any studies that looked into this?
I don't know that. I think if we look at music as a mindfulness exercise, I suspect that there would be similar benefits. I think if we're engaged in anything where we're being mindful, in other words, we're paying attention to that moment without judging and engaged fully in whatever it is we're engaged in, that's going to produce a similar effect. That's my opinion. I don't know of the literature on that.
Okay.
I noticed there was one earlier about biofeedback as well. I'm not sure we answered that. I do not use biofeedback. There are some folks who do. Not sure if there was more to that question.
Okay. We do have another question here that asks, is it helpful and worthwhile for family members of an individual who has a brain injury to practice mindfulness? And that's even if their loved one who is injured can't or won't participate.
Mindfulness is a pretty personal thing. And it's certainly not, it wasn't designed to be used specifically with folks who've experienced any kind of trauma. I think to the extent that it's beneficial to either the trauma survivor or to the family or other loved ones or significant others who are also experiencing stress as a result of that trauma, I think it can be useful, yes.
Okay. I think that covers, I'm just scanning through quickly, I think we covered those questions, which were terrific. And thank you all for a lot of really terrific questions and some good engagement. We really do appreciate that a lot. So thank you, Dr. Brownsberger. And thank you all for participating in today's Heads Up webinar. We certainly hope you found it informative and hopefully maybe even a little relaxing. Our series is going to take a holiday for the month of December, but we'll be back in January to kick off 2013, and we hope you'll join us. You can watch for details about this series and all of Bancroft's programs by following us on Twitter or at bancroft.org and liking us on Facebook. If you have any questions about today's webinar or future events, you can contact me at 856-616-6454 or at email lynn.tomeo@bancroft.org. So thank you again for participating, and we wish you a happy and peaceful holiday season.